So I've been referred to a different speciality from my GP. They've sent obviously the referral off, and I've just got a letter today to say that I need to choose which clinic I want to go to. So there's an option of 7 different clinics. So I thought, oh, that's quite good, isn't it? So they give you a booking reference number, an access code, and then you have to put your year of birth as well. So I've gone on it. So out of the 7, I could only book with 4 of them. 3 of them, my first appointment would be in April 2026. What? April 2026. We're currently in July 2024. I'm like, how is that even right? Luckily, one of the other ones, the soonest I could get in was October. But we're still waiting, obviously July, August, September, October, 3 months. So I can't really complain at that. But the 2 that are closest to me, no, the 3 that were closest to me, April 2026, to be seen by a speciality. Is that not just crazy?
So after I finally got the referral I had been begging for several GP appointments, I received a letter saying that the wait list is an indefinite one. Literally no time scale whatsoever. It's just like, we'll call you when there's news. And they only called me 10 months later for a problem that was causing excruciating pain. So 10 months later, they called me and said, the only reason we're able to give you this appointment is because of a cancellation. I actually want to know, how long are people waiting on waiting lists to see a specialist in anything? And do you think this waiting list problem is going to get better anytime in the short term or in the long term?
GP surgery, how can I help you? Let me stop you right there. Is it an emergency? Are you sure? Alright, What seems to be an issue then? Tummy aches. Can you just take paracetamol and ibuprofen as much as you can? Alright, you'll be fine. Thank you, bye. GP surgery, how can I help ya? What are your symptoms, please? Alright, headache. Have you tried taking paracetamol? And what about ibuprofen? You did, and it doesn't help. And what about mixing both of them? What's your name, please? How do you spell that? Is it with a K or is it with an A? Let me just ask you some general question. Are you conscious and breathing? You are. Perfect. Are you having a heart attack? You don't. That's good. I can book you in for Tuesday, the 20th of April 2029. Okay, no problem. In that case, love, you just take paracetamol and ibuprofen as much as you can. Thank you, bye.
I just paid £400 for an MRI. Yes, you heard me. £400 for an MRI scan. Like, we know the NHS is getting bad, but guys, the NHS is really getting bad. Side note, if you're the loonies from the other videos that think that anyone can put on a wig and a dress and think that they're a woman and try to say biology doesn't exist and think that anyone should have access to changing rooms where women are and where young kids are, scroll off this video. You don't possess the intellect to understand what I'm gonna say. So guys, I needed a scan and I thought, got a doctor's appointment finally. Yeah, we all know waiting times are bad. Imagine they gave me an appointment for December 2025, not for the scan, just to see a consultant. That's right, that's more than 9 months waiting just to see the consultant. Mate, we need to do something about this NHS. I heard Starmer's getting involved with NHS more. We need to really realise what's going on here, and also we need to save money if you can. A little £5 here, a little £10 there, a little £15 if you can, and put it towards a health box, like a health pot. If you have Monzo, Starling, the digital banks, put a health pot, start putting money back, because it's only by the grace of God I could afford to pay for that £400 MRI. If I didn't, I would have to be waiting until December just to see a consultant, and who knows what could be going on with my health. Health is wealth, as you know. Mwah, have a good week.
The UK health system is so far behind compared to other countries. And here's why. So a couple of days ago, I was feeling very ill and decided to go to hospital to see a doctor in Thailand. And I kid you not, within 15 minutes of me checking into the hospital, I was seen by a doctor, told exactly what was wrong with me, prescribed the medication that I needed, and I picked it up instantly. Not to mention that this hospital that I went to looked like a 5-star resort combined with a luxury shopping mall. Absolutely nothing like the outdated NHS buildings in the UK that literally look like council estates. And we love to think that we have a good healthcare system in the UK, but I probably would not have even seen a doctor or have even managed to get an appointment. And if I wanted to get seen using the NHS, I would have had to go to A&E, and they would have easily made me wait 5 hours at least. And that's the sad reality of the NHS. Unless you're about to lose your life, good luck trying to get any help in the UK. And yes, the NHS is free. UK healthcare is free. If you think about it, it really isn't, because it costs you hours of time and energy only for them to not know what's wrong with you and tell you to go back home. Personally, I would rather pay for my own healthcare, go via the private route, and actually get a quality service. But let me know your thoughts about the NHS in the comments.
Sorry for the 4-year wait. Why don't you tell me what's up with you? Yeah. Bloating, blood in your poo, your foot fell off. Sounds like you're a fat, ugly, depressed piece of shit. So why don't you sort that out, and we'll rush through your follow-up, see you in about 4 years.
NHS waiting times are an absolute joke. So I've been on the waiting list with the NHS for something for about 8 months now. And it's gotten to the point where they are basically even telling me that NHS is a joke. These are actual NHS employees telling me that the NHS is overwhelmed and it's just not what it used to be. And I think it's great that we have the NHS. I think it's great, we pay for it, but I do think it's great. It's better than countries like America, where if you don't have private healthcare, you're screwed. But I think there comes a time where you got to look at the marginal benefit that you're getting. So I eventually got fed up with the NHS and I've decided to go down the private route. So I went to a private doctor and I explained what I'm going through. The initial consultation was £300, and that was just to be seen. Anyway, after going through the consultation, that doctor mentioned that there was a slot that I could be seen that very day, like the same day. And it just made me think how many issues and problems that people have in life that can just be solved by just having money. Like, I'm not a huge fan of having money to be flashy and show off on other people. But I think if you can amass some money and use it for good, like when you have health issues, you can get them sorted out quickly, you can help your family members, is such a flex.
Guys, the UK health system is so far behind compared to other countries, and let me tell you why. So over the last few months, I've had some problems with my skin. I've recently moved to Thailand as of maybe 2 weeks ago now, and I'm still getting the same problems, and I've been suffering with it, I'll be honest. So I thought, you know what, let me just go to a walk-in doctor's in Thailand, let me see what it's like. It's probably going to cost me a bomb, but let me just go, because I need to get it sorted, you know what I mean? And bearing in mind, in the UK, I've seen over 5 GPs, and none of them had a clue what it was, and what they did diagnose me with, was not even the right thing. So tell me why I've walked in the doctor's and I'm seen within 5 minutes. I just had to sign a form. I'm sitting down in the doctor within 5 minutes and he tells me exactly what's wrong with me. Literally straight to the point. None of this and ahhing, none of this, I don't know, it could be this, it could be that. Let me try you on this, let me try you on that. He literally just said, look, it's this and this is the medication I'm going to give you for this. And literally 15 minutes later, I've walked out, I've got my medication, I'm going back in 4 days. And the next thing you're probably going to say is, Cam, while the NHS is free in the UK, it's free, you've probably paid loads. This cost me less than £15. And that's including to see a doctor and to also get my medication. Am I missing the point here, or is the UK just so far behind? Let me know in the comments, man, because this is bad.
This is more than just poor hospital care. God help me. What I've experienced in the past 2 weeks under Bart's Health NHS Trust is abuse, neglect and cover-ups. And I've been speaking out. I'm speaking out now, not just for myself, but for the vulnerable patients who can't. I've been recovering from spinal surgery, completely dependent on nurses. And instead of care, I have faced neglect, isolation, and outright cruelty. I have complained repeatedly to the nurses in charge, to the ward manager, to the site manager, and even the doctors. And every time my concerns were ignored, dismissed, or covered up. And I have watched dementia patients being abused, mocked, mistreated and neglected because they can't even remember long enough to complain. And when I raise these concerns, I was met with excuses and lies. When I directly accused staff of mistreating me, I was met with more lies, gaslighting, and then just silence. The neglect I faced has included nurses moving my call bell out of reach, so so I couldn't ask for help. Deliberately delaying my medication. Liquid morphine, which is supposed to be for my pain relief. Refusing to help me to the toilet while I was immobile after surgery. Forcing me to use a Zimmer frame before I had even learned how to stand again. Leading to a fall where I was left on my back. I fell on my back and I was crying for hours in pain. Lying to cover for each other, when confronted with the ward manager, defending their actions instead of holding them accountable. The nurse in charge had the audacity to say to me that they barely get complaints. And I told her that's because most of your patients have dementia. They can't remember long enough to even report you. It took me screaming my complaints out loud to the ward, to even be acknowledged, because talking privately to the managers, to the nurses, and, they did nothing. They promised investigations. They promised follow-ups. They promised calls and emails. None of it has happened. None of it. I was ignored because this hospital operates on a culture of silence, of protection, not patient care. And I don't know if I need to sue or expose them fully yet, but I know this. I will not be silent. I have recorded proof where I can. I have documented everything. And when I'm finally out of this hospital, I will tell my story step by step. I will fight for myself and I will fight for the patients who can't. Because if this is happening to me, if this is happening to even dementia patients, how many others have suffered in silence? How many others have been ignored? It has to stop.
The NHS waiting lists have got to be a joke, right? Right? I've had this undiagnosed stomach issue for more than 3 months now, and it took an entire month for my doctor to actually give up on trying to figure out what it was and put in an actual referral. I got a letter shortly after that said, if you haven't heard anything back from this referral by the end of July, give us a call. July came and went. I gave them a call, and well, this is how it went. Hi, I'm chasing a referral that was made through your surgery. These are my details. Hello, yes, we can see that your referral was made on the 31st of May. Yes, that sounds about right. It was probably about that long ago. Okay, we're currently working through referrals that were made to us in December 23. Okay. So you should hear something back from us early next year. Right. Okay, that's... Oh, okay. Is there anything that can be done in the meantime? Yes, of course. If your symptoms get any worse, just go back to your GP and they'll be able to help you. Right, great. Thanks. I don't know what to do. I'm panicking. Because my job have been insanely supportive and patient with me. But this is too much. I did phone my doctor because my symptoms did get worse after the MRI, and she just repeated the same old, well, we just got to wait, you're not in hospital at the moment, it's not that bad, so we're just going to have to wait until you can see that specialist. I am probably just going to have to go down to the Citizens Advice Bureau and see what they say, because I'm genuinely scared right now.
I have had toothache for the last month, but it keeps coming and going. Like, I'll have it for 2 days and it'll be very painful, and then it will go for a week, and then it'll come back again for a few days. And I booked an emergency dentist appointment 3 weeks later, which meant today the dentist was like, I literally can't see a problem. What the fuck is wrong with me then? Like, he even took a picture and he's like, I don't see what the problem is. And I was like, then what could it be? Gum disease, but you don't show any signs of that either. But he looked and there's like no infection, obviously no disease or no decay or anything like that. So why does it randomly ache?
The best he could do was give me this prescription toothpaste. So now that's more money. I just spent £26.80 on this dentist appointment and my problem isn't even solved. And I got this toothpaste that I don't even actually probably need because he doesn't know what the issue is in the first place. What is wrong with me?